The link between the AstraZeneca vaccine and blood clots had been a worry for Lucy and Abby. In their early 20s, the benefits to them of vaccination were relatively small, finely balanced with the risk of the side effect. Now the medical regulator has said the under-30s should be offered an alternative vaccine instead.
It's about a balance of risk, and obviously we're still quite young, and we both are in good health, and therefore you're kind of balancing, if I do contract COVID, will I go to hospital? If I do contract it, will I be fine, and therefore is it worth getting the vaccine?
It's caused a bit more anxiety about it, but now they're obviously not offering it to young people, I definitely feel more confident about that.
20 million people had been given the AstraZeneca vaccine in the UK up to the end of March. According to a new analysis by the medical regulator, 79 had developed a blood clot, unusually at the same time as having a low level of platelets. 19 died. But the Prime Minister urged people not to lose faith in the jab.
These vaccines are safe, they've saved many thousands of lives, and people should come forward to get their jabs, and we'll make sure that they get the right jabs. And of course, I don't see any reason at this stage at all to think we need to deviate from the roadmap, and we're also very secure about our supply.
For older people, the benefit of the AstraZeneca vaccine far outweighs any risk. But the young are unlikely to become seriously ill from the disease, so the UK regulator now recommends an alternative jab under 30. That's at odds with France and Germany, who stopped using the vaccine in the under 55s. Germany drew the line at 60, but the Deputy Chief Medical Officer told me they're wrong.
The notion that you would clip a vaccine at that point is pretty absurd, really. And so, it is very much an independent decision, but I think it's been taken in an extremely rational way.
But is that decision driven by the availability of doses of other vaccines?
No, it isn't. It absolutely wasn't.
People are being urged to seek medical attention if they develop a range of side effects following the jab, including headaches, blurred vision, breathing problems, leg swelling and skin bruising. Doctors who track public confidence in vaccines say people should be reassured.
But the fact that there is many regulatory agencies looking closely to it, it should actually comfort us rather than increase this risk perception. It means that something's been done and the safety systems are all there and they're all working. So what I would say is that if you're being recommended the vaccine after all these reviews and after everything has been looked at, it means that it's safe.
The government says the new advice shouldn't delay the vaccine rollout, with adults on track to receive a first dose by the end of July. Thomas Moore, Sky News.